How often are colonoscopies needed for diverticulitis surveillance? When you experience diverticulitis, you might wonder how often you need to have a colonoscopy to keep an eye on things. The good news is that, after an episode of diverticulitis, a colonoscopy is usually recommended once, about 4 to 6 weeks after your symptoms have resolved. This timing allows inflammation to settle down, making the procedure safer and more effective. The main goal here is to confirm the diagnosis and rule out other issues like colorectal cancer, especially if your diverticulitis was complicated by abscesses or perforations. For uncomplicated diverticulitis, which means there are no abscesses or perforations, the risk of underlying cancer is quite low. In these cases, if you've had a recent colonoscopy with normal findings, repeating it solely because of diverticulitis might not be necessary. Many guidelines suggest that routine follow-up colonoscopies for diverticulitis are not needed unless new symptoms develop or other risk factors are present. In cases of complicated diverticulitis, where there might be abscesses, fistulas, or perforations, doctors tend to recommend a colonoscopy more strongly. This is because these cases have a higher chance of hiding something more serious, like cancer. But after that initial colonoscopy, if everything looks normal and you're feeling well, there's generally no need for frequent repeat procedures just for diverticulitis. Long-term surveillance colonoscopies are usually guided by standard colorectal cancer screening schedules, which depend on your age, family history, and overall risk factors. For most people who have had a normal colonoscopy and no ongoing symptoms, the next screening might be scheduled in 5 years or longer. If you develop new symptoms such as bleeding, anemia, or persistent pain, your doctor might suggest another colonoscopy to check for other issues. It's important to remember that each person's situation is different. Your doctor will consider your specific health history, the severity of your diverticulitis, and your overall risk for colorectal cancer when planning follow-up care. So, while one colonoscopy after an episode is standard, additional procedures are usually based on individual needs rather than a fixed schedule. In summary, after an acute diverticulitis episode, a colonoscopy about 4 to 6 weeks later is typically recommended to confirm diagnosis and exclude cancer. Beyond that, most people follow routine colorectal screening guidelines unless new symptoms or risk factors appear. Always consult your healthcare provider for personalized advice, as they can best tailor the follow-up plan to your health needs.